Florida Behavioral Health Network are along for the ride here. So, Doris, I say good day to you. How are you?
Yes, sir, Ronnie. Very good. It's great being here with you again. I have a very special guest here with us today talking about a very special Awareness Month we have in the month of May. His name's Alan Davidson. He's our president and CEO. Here he is.
Hey, Ronnie, how are you?
I'm well, Alan. Thank you. So I understand that CFBHN is a managing entity. What exactly is that? What do you do?
So CFBHN is a not-for-profit 501c3 corporation and a CARF International Accredited Services Management Network organization contracted with the Department of Children and Families. CFBHN fulfills its mission by contracting with community service organizations to provide a full array of publicly funded mental health and substance use services in the 14 counties that comprise the Suncoast region. Services include acute care, residential treatment, housing, medical, outpatient recovery support, and prevention.
Well, and I know this month is a very special month for persons concerned about their mental health well-being, correct? So please share some information about this month with us.
Yeah, it's Mental Health Awareness Month in May, and we should be checking in to find out how is everybody doing. In case you missed it, Sesame Street's lovable Elmo posed that very question on social media earlier this month, and the responses came flooding in. From relationship problems to financial troubles and feelings of exhaustion, angst, loneliness, and disconnection, people shared their struggles. At last count, Elmo's posts had garnered more than 217 million views, 15,000 reposts, 165,000 likes, and 45,000 responses on one social media platform alone. What this helps reveal is that many of us are not okay, and it's important to acknowledge and address that and make sure people know help is available. That's why CFBHN exists, and we have services and supports to help you be okay.
Well, and do mental health conditions affect just certain groups of people at only certain times in their lives?
Absolutely not. Mental health conditions can affect anyone, regardless of gender, age, race, ethnicity, or income level. Recent data underscores that our nation is facing an unprecedented mental health crisis among people of all ages and backgrounds, including young children and older adults. To put this into perspective, if you are standing in a room full of people, at least one out of every 5 of those people likely experience anxiety, depression, or other mental health conditions in the last year. The good news is mental health conditions are treatable, as illustrated by many athletes, entertainers, and prominent public figures who have spoken openly about their experiences. People living with mental illness can and do lead happy and productive lives. And this includes serious mental illnesses such as bipolar, major depressive disorder, and schizophrenia, which can interfere with someone's life and ability to function. Similar to medical conditions like diabetes, with early and consistent treatment, people with serious mental illnesses can manage their conditions, overcome challenges, and enjoy meaningful, productive lives. At CFBHN, we are committed to increasing access to mental health services and supports. We understand that many Americans may feel reluctant to reach out for help or seek care. We want you to know that we see you, we hear you, and we support you. We believe that with the right care, anyone affected by or at risk for a mental health condition can achieve well-being and thrive. And if you take care of yourself, you might also be a support for others, a lifeline for someone else.
So what can we all do now to make sure we take care of others and ourselves?
Well, May 16th is Mental Health Awareness Day, and it provides an opportunity to take the next step from awareness to action for yourself, a loved one, or your community. This could be as simple as adopting a positive mental health habit like eating a balanced diet, getting a good night's rest, or exercising, or offering support to a friend or family member who is struggling. Here are some additional strategies to consider. Practice gratitude. Think about what you're thankful for, like supportive family, friends, a safe home, or even a beautiful day. Volunteer. Participating in community organizations and finding opportunities to help others can provide a positive boost and a sense of purpose. Engage in random acts of kindness. Buy a cup of coffee for the person standing in line behind you, hold the door open for a stranger, or make food for a neighbor or colleague. And practice mindfulness. Take a few minutes to meditate, take a yoga class, or do some breathing exercises to promote relaxation and reduce stress. And then finally, seek help, whether it is for yourself or someone else. Seek help through CFBHN's resources. Recovery is possible.
Alan, thanks. You've been great. Doris, any lasting words here before we move on?
Just remember, all of our parents out there, that we ask you to talk to your children. Talk They Hear You's our campaign about preventing underage alcohol consumption. And these tips about mental health awareness are wonderful as well, because they also apply to yourself and your children. We're here to help. www.cfbhn.org.
All right, thank you both.